Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today's topic is why some women have difficulty in reaching orgasm. So let's go to the topic. Many women experiences difficulty in reaching the orgasm, and it is actually very common. Studies shows that a significant number of women need the right physical stimulation, emotional comfort, and hormonal balance for orgasm to occur. Several factors can affect it. One is lack of clitoral stimulation. The clitoris is the main organ responsible for female orgasm. Important facts are it contains thousands of nerve endings over there. Many women cannot reach orgasm from vaginal penetration alone. Direct or indirect clitoral stimulation is often necessary for female orgasm. If stimulation is mainly vaginal, orgasm may be difficult. Now, the second factor, psychological factors. The brain is the most important sexual organ in female. Mental state strongly affects the orgasm in female. Common psychological factors include stress or anxiety, fear or shame about the sex, lack of emotional safety with a partner, overthinking during intimacy, or past negative sexual experiences. When the brain is tense or distracted, the body may not reach the level of arousal needed for orgasm. Now, the third factor, hormonal changes. Hormones play a major role in sexual desire and orgasm. So, the major hormones included in this in orgasm are estrogen affects the vaginal lubrication and sensitivity, testosterone influences the sexual desire in women, and oxytocin involves bonding and orgasm, dopamine a part of brain's pleasure system. Low hormonal levels, for example, after childbirth, during menopause, or with some medications, can reduce sexual responses. One another point I want your attention is there is a lot of time difference between the male and female readiness for intimacy. So, in most prone, that is the ovulation time, is the most women experiences the most sexual desire. Even that time, a woman need around about 2 hours of stimulation to reach is the readiness for intimacy. So in other days, that is in an ideal menstrual cycle, the 14th day is the ovulation day. Around that time, usually women experiences more desire, or the most desire is peak in those days. And even that time also, a woman needs about 2 hours of stimulation, or 1.5 to 2 hours of stimulation to reach the readiness for intimacy. So keep in mind that in other days they need even more time for readiness or for sexual intimacy. They need more time for sexual intimacy. Now the next factor is lack of adequate arousal time. A woman usually require longer arousal time than men. If the body is not fully aroused, blood flow to the genital organs is lower, lubrication is reduced, and nerve sensitivity decreases. This can make orgasm harder to reach. Okay. Now the another factor, next factor is relationship factors. Emotional connection affects sexual responses. Things that can interfere include poor communication between partners, feeling pressured to orgasm, lack of trust or intimacy, relationship conflicts. Feeling safe, relaxed, and emotionally connected often improves the sexual responses. Now, let's look into the next factor, medical or physical conditions. Certain health conditions can affect orgasm. Examples are endometriosis, depression, diabetes, pelvic floor muscle problems. Some medications, especially antidepressants, can also reduce the orgasm ability. Okay. Important point to remember is that difficulty in reaching the orgasm does not mean something is wrong with the woman. Female sexual responses varies widely and many factors influence it. That's all about today's topic. Mm, we'll come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.